Time for the BBL talk. It seems like it's spreading like wildfire. Everyone's got one. Do you want one? If you don't know by now, it is the Brazilian butt lift. What is it? Why does it exist and why is it so popular? And where are we going with this? Let's talk about it. So BBL is short for Brazilian butt lift. It's become incredibly popular, but some people who have been living under a rock still don't know what exactly it is. So, a Brazilian butt lift is just the fancy term for a buttock augmentation. Typically, the buttock in this case is augmented with fat that we harvest from other parts of the body, like the belly, the back, the inner arms. For some people who don't have significant fat stores, we can also use silicone implants. They should not be confused with the implants that we use for breast implants. However, they are firmer and so much more akin to what a real buttock would feel like instead of what a soft breast should feel like. Other things that have been used are fillers, and then there are those dangerous things we've been calling butt shots, which we'll break down a little bit further too. So currently, the BBL represents the most dangerous surgery we do as plastic surgeons. We have seen the most of any procedure that we do in terms of deaths as it relates to the procedure. While by and large, it's a largely historical number, the risk is still very present. So why is it so dangerous? So when we first started doing the BBL as a plastic surgery field, the thought was if we inject it into the muscle, we enlarge the muscle and we increase the buttock, but still maintain its softness and maintain its good form. What we were finding is, and there's been literature to look at this, is that when you actually inject it into the buttock muscle, the fat itself migrates down through and into the vein. This fat then becomes a fat embolus, which can travel to the lungs and cause serious dysfunction in the heart and the lungs, which can be ultimately deadly. Since we've learned this, the intention now of most plastic surgeons, and should be all plastic surgeons, I should say, but unfortunately, it's still not everybody. The intention of most plastic surgeons who, again, are well-trained, board-certified, is to inject it above the muscle in that layer that we call subcutaneous fat layer. And that layer is completely safe. We're not seeing migration of the fat into the veins, and therefore it becomes a more safe procedure. Now, why it's not historical and why I still say most is that there were some places where they were basically BBL factories. They were doing this all day, and in some ways getting a little sloppy. And so in their patients, you would see some migration because they were either accidentally or intentionally going to the muscle and having, again, the fat migrate down into the deep veins. And so that leads me again to my favorite PSA, right? Which is really do your homework before you get this procedure done. Figure out who your plastic surgeon is. Really. How well did they train? How many have they done? How many deaths have they reported or have been reported in their patients within 30 days after the procedure? These are the kinds of questions that elicit hopefully honest answers and hopefully reveal truly what your risks are for undergoing this procedure. Another way that this has proven deadly, but to a much lesser degree and to a lower number, is by unintentionally creating injury into the small intestine, the bowel. How does that happen? So when you're doing liposuction, the whole idea is to stay, again, in that subcutaneous fat above the muscular layers in your body. in the belly, if you inadvertently get underneath that muscular layer, then you're violating what's called the peritoneum. The peritoneum is a lining that surrounds all of your internal organs in the belly. Your stomach, your small intestine, your large intestine, your liver, etc. If that lining gets disrupted, then you can have what we call inadvertent bowel injury. It's very, very rare, but it can happen. And if it does, it can cause what's called sepsis, and it can lead to death. This is not meant to scare you. This is not meant to dissuade you from getting surgery, but this is meant as a reality check, right? These are the risks that you're undertaking. And this is why this isn't just, hey, I'm going to so-and-so to get my BBL. I'm going to come out looking fly. We need to really have a consciousness around surgery, even when it's completely aesthetic and completely elective. It is still surgery. It's still a big deal. For that reason, I never say that surgeries are easy or hard. I say they are either more straightforward or more challenging, right? So you need to be aware of your own body. Do you have any hernias? And you need to be aware of who's operating on you and what they're capable of in terms of great results and what your risks actually are. But the BBL remains popular. In experienced hands, it is a good surgery to do. It is a good surgery to have done. It can boost self-esteem, and that's why it's so great. It can literally change the shape of a woman. And even men. Men get BBLs too. Did you realize that? It changes the shape to something that is more in tune with how people want to feel and look. And that's why it's so popular. The other reason that it's so popular is that because you're using your own tissue. You're not necessarily using an implant that may have to be replaced in a couple of decades or 10 to 15 years. You're using your own tissue. That's why it's become so popular, in addition to creating a great shape. And for women, if you think about it, and we've talked about this before in the Kim K video, it really does fall in line with where beauty trends are trending, right, currently. So historically, anthropologically, if you were a woman in the hunter-gatherer times of our lives, and you had a smaller waist, rounder buttocks, bigger breast, you were considered fertile, and so you were more attractive to men. And so while we've gone through ebbs and flows of what the ideal feminine physique looks like, these principles still hold true. There are some associations with fertility. There are some associations with more attractiveness. And, that has always been smaller waist, rounder butt, and breasts. Yeah, it's very simple. So is everyone going to get a BBL? Are you going to get one? Well, maybe now you feel too scared to get one, but I assure you it is still a safe procedure. So I don't want to scare you away from it. I just want you to be cautious of what you're undertaking if you're going to have it done. But where are we going with this? It seems like everyone is going to Miami, dare I say, or the DR or Mexico to get their BBL and their mommy makeover. And we talk more about that in our tourism video. But is it getting out of hand? Is everyone really getting it? Am I going to get one? No, I'm not getting one. I like my small booty. But really, where is this going? So, as I've said before, there is always a counter movement when there is a movement, right? And I think we're seeing that. We're seeing that the counter movement is alive and well, that not everyone wants a BBL. Shocking. I know, Instagram would have you believe differently. But it's true, not everyone wants a BBL. And I think even in people who have gotten BBLs, we've seen their butts look a little bit smaller, right? I'm not naming any names. I'm just saying, look at them over time and you notice there's been a little bit of a difference in their posterior region. But where do you think this is going? Leave your comments and your questions below. Stay tuned for part 2 where we talk more about the BBL and what an ideal BBL looks like. As always, love you lots, and bye for now.